So I just started recording and I'm going to pass it on to Dr. Lasala to begin the presentation.
Hello, and welcome to Stony Brook Medicine's Healthy Libraries program discussing disinfection during the COVID-19 pandemic. Next slide. I would like to introduce the presenters and the contributors to today's presentation. My name is Mary Ellen Lasala. I am the chair of the Department of the Undergraduate Studies School of Nursing, and I teach population health for the undergraduate students. Today we will have presenting Gabriella Pendafelli. She's a graduate student, Masters of Public Health, and Philip Massaro, nursing student, Bachelor's of Science in Nursing. Contributors to this presentation is Dr. Lisa Ben-Scott. She's professor and director, program in public health. Dr. Carol Delarada, associate dean for academic affairs and strategic partnerships, School of Nursing. Professor Leah Topak Walker, she's a field education coordinator, School of Social Welfare, and Professor Jessica Cruz, health sciences librarian, School of Medicine, program in public health and biomedical informatics. And we do have Dr. Lisa Ben-Scott with us today, and she will be, yes, she's saying hello. Hello, Dr. Ben-Scott. Okay, so I am very happy to be here today to be part of the Healthy Libraries presentation. I am the coordinator of the School of Nursing's Healthy Libraries program and context expert that assisted in preparing this webinar. I have been teaching at Stony Brook for over 6 years, and I have a long and wonderful nursing career that I've been teaching critical care. I've been a neonatal, pediatric, and adult ICU nurse, and my interest is pregnant adolescents in the community health. Next slide. And I would like to introduce Gabrielle Pendafelli. She will be presenting, and she has completed her first year as a master's in public health student concentrating in health policy and management. She is the program coordinator for this Healthy Libraries program. Philip Massaro. He is a senior nursing student in the School of Nursing at Stony Brook University, working towards becoming a nurse, and he will be graduating next year at this time. He's certified as a health education specialist, American Heart Association CPR instructor, and a New York State firefighter and critical care EMT. Welcome to both our wonderful presenters. Next slide. So Stony Brook Medicine's Healthy Library program is also known as HELP, H-E-L-P. It's a partnership with the public libraries of Suffolk County, the Suffolk Cooperative Library System Outreach Services Department, and is supported in part by the American Heart Association of Long Island. The program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, case management to a diverse community of patrons in the public library setting. Another aim is to refer patrons to promote access to promote health and social services programs locally that will address their health and social support needs. The last aim is for students to experience an interprofessional team and demonstrate the core competencies based on the interprofessional education collaborative team. So by the end of this webinar, participants will be able to identify at least 3 symptoms of COVID-19, identify how COVID-19 spreads, identify the % of alcohol content needed in hand sanitizers for it to be effective, list the personal prevention behaviors, identify how face masks should be worn and used, identify situations when gloves are needed, identify how to make a solution of disinfectant from bleach, and feel confident in your ability to use personal prevention and disinfection during the COVID-19 pandemic. So please put yourself on mute. If you would like to ask a question, please use the chat function or unmute. Just one more thing. We are so pleased to be able to share this information with the Brentwood community today that has been so hard hit by this pandemic. Thank you. I would like to introduce Gabriella now to take over.
Hi, sorry, I was having some technical difficulties.
No
Thank
problem.
you. So now I'm going to talk a little bit about what is COVID-19. So COVID-19 is a respiratory illness that can spread from person to person, and it's a beta coronavirus named SARS-CoV-2, which is similar to other respiratory viral outbreaks like MERS and SARS. It's a disease process that arises from the SARS-CoV-2 virus strain, and coronaviruses are a large family of viruses that are common in people as well as different species of animals. So now we're just going to watch a brief video explaining what COVID-19 is.
Coronaviruses are a family of viruses that cause sicknesses like the common cold, as well as more severe diseases such as Middle East Respiratory Syndrome or severe acute respiratory syndrome. A novel coronavirus is a new strain, one that has not previously been recognized in humans. Coronaviruses cause diseases in mammals and birds. A zoonotic virus is one that is transmitted between animals and people. When a virus circulating in animal populations infects people, this is termed a spillover event. It is speculated that the 2019 novel coronavirus, or COVID-19, originated in bats and was transmitted to humans, possibly with pangolins as an intermediate host. Unfortunately, COVID-19 is now spreading from human to human as well. COVID-19 has surpassed the SARS death toll in a matter of weeks. Even though the death rate is much lower, it spreads faster. Early data suggests that in around 82% of cases, symptoms are relatively mild. The illness begins and ends in the lungs. However, the remainder of cases are severe or critical, typically in older or immunocompromised individuals. How does COVID-19 affect the body? The virus is fitted with protein spikes sticking out of the envelope that forms the surface and houses a core of genetic material. Any virus that enters your body looks for cells with compatible receptors, ones that allow it to invade the cell. Once they find the right cell, they enter and use the cell's replication machinery to create copies of themselves. It is likely that COVID-19 uses the same receptor as SARS, found in both lungs and small intestines. It is thought that COVID-19 shares many similarities with SARS, which has 3 phases of attack: viral replication, hyperreactivity of the immune system, and finally, pulmonary destruction. Early on in infection, the coronavirus invades 2 types of cells in the lungs: mucus and cilia cells. Mucus keeps your lungs from drying out and protects them from pathogens. Cilia beat the mucus towards the exterior of your body, clearing debris, including viruses, out of your lungs. Cilia cells are the preferred hosts of SARS-CoV and are likely the preferred hosts of the new coronavirus. When these cells die, they slough off into your airways, filling them with debris and fluid. Symptoms include a fever, cough, and breathing difficulties. Many of those infected get pneumonia in both their lungs. Enter the immune system. Immune cells recognize the virus and flood into the lungs. The lung tissue becomes inflamed. During normal immune function, the inflammatory process is highly regulated and is confined to infected areas. However, sometimes the immune system overreacts, and this results in damage to healthy tissue. More cells die and slough off into the lungs, further clogging them and worsening the pneumonia. As damage to the lungs increases, stage 3 begins, potentially resulting in respiratory failure. Patients that reach this stage of infection can incur permanent lung damage or even die. We see the same lesions in the lungs of those infected by the novel coronavirus as those with SARS. SARS creates holes in the lungs, so they look honeycomb-like. This is probably due to the aforementioned overreactive immune response, which affects both healthy and infected tissue, creates scars that stiffen the lungs. As such, some patients may require ventilators to aid breathing. The inflammation also results in more permeable alveoli. Alveoli are the location of the thin interface of gas exchange, where your lungs replace carbon dioxide in your blood with fresh oxygen you just inhaled. Increased permeability causes fluid to leak into the lungs. This decreases the lungs' ability to oxygenate blood, and in severe cases, floods them so that you become unable to breathe. Sometimes this can be fatal. The immune system's overreaction can also cause another kind of damage. Proteins called cytokines are the immune system's alarm system, recruiting immune cells to the infection site. Overproduction of cytokines can result in a cytokine storm, where there is large-scale inflammation in the body. Blood vessels become more permeable and fluid seeps out. This makes it difficult for blood and oxygen to reach the rest of the body and can result in multi-organ failure. This has happened in the most severe cases of COVID-19. Although there are no specific treatments for coronaviruses, symptoms can be treated through supportive care. Also, vaccines are currently in development. So, what can you do to protect yourself from COVID-19? Advisories vary in different countries, but the basic protocol comes down to regular hand washing, avoiding close contact with anyone coughing or sneezing, avoiding unnecessary contact with animals, washing hands after contact with animals, thoroughly cooking meat and eggs prior to consumption, and covering your mouth and nose while coughing or sneezing. Respiratory viruses are typically transmitted via droplets in sneezes or coughs of those infected, so preventing their travel stops the spread of disease.
Coming soon. Should you wear a mask? And if so, what kind?
All right, so there's also an additional video linked here, and it's a longer video explaining more in depth about coronavirus. And if you'd like to see that, the slide deck will be available for you after the presentation if you'd like to view that video. So now we're going to talk about who can get sick. Any person can get sick with the coronavirus, COVID-19, and it affects any age. Some people are at a higher risk of developing serious complications from COVID-19. Those are typically older adults or people who have serious medical conditions like heart disease, diabetes, lung disease, hypertension, and those who are immunocompromised. There have been cases reported in all 50 states plus the US territories, and as of June 15th, there have been over 2 million cases of COVID-19 in the United States, with 115,644 total US deaths. As for New York State, it has the highest number of cases with 388,719 confirmed cases and 30,645 deaths. So how does it spread? The coronavirus spreads person to person between people who are in close contact through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can enter the mouth or noses of people who are nearby or possibly be inhaled into the lungs. COVID-19 may also be spread by people who show no symptoms. So the virus does not spread through these typical ways, and COVID-19 is a new disease, and researchers are still learning how it spreads. So these are not the main way viruses spreads, from touching surfaces or objects, from animals to people, or from people to animals. So here are the symptoms of COVID-19. The symptoms include fever, cough, and shortness of breath, and there are some newer symptoms listed on the CDC website, which are muscle pain, new loss of taste or smell, chills, sore throat, nausea, vomiting, or diarrhea. And you should seek medical attention immediately if there are emergency warning signs such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. So there are some primary prevention ways that you could do to limit your risk of getting COVID-19. Everyone should maintain social distancing 6 feet apart. You should clean your hands with soap and water, and if soap and water are not available, use a hand sanitizer with at least 60% alcohol. You should cover your mouth and nose with a cloth face cover when around others or when in a public setting. And you should always cover your coughs and sneezes, as well as clean and disinfect, which we'll be discussing in more detail later in the webinar. So now we're gonna watch a brief video about proper hand washing and why hand washing is really important.
At Farmers customers, we know a thing or two because we've seen a thing or two, like how nice it is to save on your auto policy.
You know that the best way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands.
But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus, like coronavirus, looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses in their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice. Happy birthday, dear, I guess me. Or the chorus to Lizzo's Truth Hurts. Straight to my face. Or Prince. Raspberry beret. Or Eminem. Go, go, only go. Or even Dolly. Jolene, Jolene, Jolene. Just as long as it's 20 seconds. And you're using the ultimate virus annihilator, soap.
So now we're going to talk about other ways that everyone should limit risk recommended by the CDC. So the CDC recommends limiting errands. Family members should only leave the house when absolutely necessary. And if you must leave the house for an essential errand, choose 1 or 2 family members who are not at a high risk to go. Wear a cloth face covering, avoid crowds, and practice social distancing whenever in public. If possible, do not use public transportation, and if you must use public transportation, practice social distancing and avoiding high-touch surfaces. Do not ride in a car with members of different households. Limit contact and create space within a vehicle if you are using a car for transportation, and improve airflow in the car by opening the windows or placing the air conditioner on non-recirculation mode. Wash hands immediately when you return home, and maintain as much physical distance with those at high risk who stayed at home when you return home. As for accepting deliveries, Limit in-person contact if possible. Pay online or on the phone when you order, and ask for deliveries to be left in a safe spot outside of your house with no person-to-person interaction. So this could be having deliveries left in the mailbox, or if you order food, you could have food left on your front porch, and you can wait till the delivery driver drops your food off and leaves before you go and get your food. Otherwise, stay at least 6 feet away from a delivery person and wash your hands or use hand sanitizer after accepting deliveries or collecting the mail. So those at high risk should avoid caring for children. Adults 65 years and older and people who have serious medical conditions should avoid caring for children in their household. People at higher risk, if people at higher risk must care for the children, then the children should not have contact with individuals outside of the household. And those at high risk should avoid taking care of the sick. Anyone who's sick at any age, high risk people should avoid taking care of those who are sick. So now I'm going to pass it on to Mr. Massaro, who's going to discuss wearing cloth face masks.
Hello, everyone. So we'll continue on. And we're going to speak right now about encouraging everyone to wear cloth face coverings. So how to wear cloth face coverings. So we want to make sure that they fit snugly but comfortable against the skin. Make sure that they're secured with ties or ear loops. Make sure that they include multiple layers of fabric. Allow them to breathe without restriction. We want to make sure that they're able to be washed and machine dried without damage or change to shape. Also making sure that we routinely wash them depending on how frequently we use them. Also making sure that we do not place these masks on children under the age of 2 and anyone who has trouble breathing, unconscious, they're incapacitated, or someone who has the inability or they can't remove it themselves. Also making sure when you're wearing these masks, make sure you don't touch your eyes, your nose, your mouth while you're removing them. Make sure you pull from the side of the ear loops or untie them from the back and remove them forward and into a brown bag or your linen drawer where you're going to then wash them. Make sure that you then wash your hands immediately after removing the masks. So moving on to general CDC or the Center for Disease Control, they have guidelines or rules on disinfecting your home. So how to clean and disinfect. We want to make sure that we wear reusable or disposable gloves, clean surfaces using soap and water, and then move on to a disinfectant. Some people misunderstand the difference between cleaning and disinfecting. Well, cleaning with soap and water reduces number of germs, dirt, and impurities on the surface. When disinfecting is performed and kills germs on the surface. It's important that we routinely clean frequently touched surfaces. These surfaces can include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks, etc. Many surfaces that we touch every day. If an item is dirty, we want to make sure that we clean it with soap and water, then use a household disinfectant by following the instructions on the label. Make sure that we keep the surface wet for a period of time, wear gloves, and make sure that you have a well-ventilated area. Disinfectants that are alcohol-based must have at least 70% alcohol in them. Diluted household bleach can also be used, and we'll talk about that in a bit. Now, when to wear gloves. It's important to wear gloves when you're cleaning and caring for someone sick. So if you're providing care to someone who is sick at home or in another non-healthcare setting, we want to make sure that we use disposable gloves when cleaning the disinfected areas around the person who is sick or other surfaces that they frequently touch at home. Also, be sure to use disposable gloves when touching or having contact with their blood, stool, or any other body fluids that might be produced. After using disposable gloves, throw them out in the lined trash can. Do not disinfect or reuse the gloves. And then make sure finally to wash your hands after you remove the gloves. Now we'll talk about a few instances where gloves are not needed. Sometimes outside of these instances. So wearing gloves outside of these instances, example, using a shopping cart or using an ATM. Using gloves will not necessarily protect you from getting COVID-19 and may still lead to the spread of germs. The best way to protect yourself from these germs when running errands and after going out is to regularly wash your hands with soap and water for 20 seconds, or use hand sanitizer with at least 70% alcohol. Some other ways to protect yourself from the respiratory virus that is COVID-19. And as a reminder, this is spread through droplets that are created when an infected person coughs, sneezes, talks. So you can protect yourself by keeping socially distant, at least 6 feet from them and others, and washing your hands with soap and water for at least 20 seconds. Next. Now, how to use household bleach. We talked about just a few slides ago using bleach as a disinfectant. So diluted household bleach can be used in place of disinfectants if appropriate for the surface. Want to make sure that the bleach is not expired. Make sure you follow the manufacturer's instructions. And do not mix ammonia and bleach or any other cleanser. Leave the solution on surface for at least 1 minute and then completely dry the surface. To make the bleach solution, you can take 5 tablespoons or 1/3 of a cup of bleach per gallon of water, or a smaller amount is 4 teaspoons of bleach for 1 quart of water. Now, cleaning soft surfaces. So what are some soft surfaces? For soft surfaces such as carpets, rugs, and drapes. When cleaning soft surfaces, you want to make sure that you use soap and water and cleaners appropriate for the use of these surfaces. The cleaners will have an itemized list of what is appropriate for these surfaces. Also making sure that some of these surfaces can be laundered or sent to the laundromat if possible. You want to make sure you also disinfect with EPA registered household disinfectants. And we'll talk about those in a bit. Now, cleaning those electronics, the electronics that we use every day, such as tablets, cell phones, touch screens, keyboards, remote controls, and ATM machines. If possible, we want to put a wipeable cover on these electronics. That's just a screen protector or as a plastic covering, plastic case. We want to make sure we follow the manufacturer's instructions for disinfecting as well. If there are no instructions, be sure to use alcohol-based wipes or a spray containing at least 70% alcohol and dry the surface thoroughly after using it. Now, how to clean laundry. For clothing, towels, linens, and other washable items, we want to make sure that we wear disposable gloves. Wash your hands with soap and water as soon as you remove those gloves. Make sure that you do not shake the dirty laundry to prevent the spread. Use the warmest water possible and dry items completely. So dirty laundry from a sick person can be washed with other items as long as you wash it appropriately. Make sure that we clean and disinfect your hampers, your laundry baskets, according to guidance for the surfaces. And as lastly, always remove the gloves and wash your hands right away after handling dirty laundry. Washing your hands often, really the key here. So we want to make sure that we wash our hands often with soap and water for at least 20 seconds. Always wash your hands immediately after removing gloves or being in contact with someone who's sick. When to use hand sanitizer. Hand sanitizer, it can be used if soap and water is not available and hands are not visibly dirty. So making sure that there's not anything visibly dirty on your hands, any dirt or grime. Making sure that the hand sanitizer is at least 60% alcohol. Some key times to wash your hands. After blowing your nose, coughing, sneezing, using the restroom, eating or preparing food, and after providing care for another person. You want to make sure you also avoid touching your eyes, nose, and mouth with unwashed hands. We'll talk about cleaning and disinfecting if someone is sick. So if someone is sick, regarding their bedroom and bathroom, if possible, keep a separate bedroom and bathroom for the person who is sick. I understand that that's not possible for many households and many families or locations of where you live, but we want to try and best and keep that distance between those people. The person who is sick should stay, if possible, in a separated from other people in the home. If you have a separate bedroom and bathroom, wear disposable gloves and only clean the area around the person who is sick when needed, such as when the area is soiled. We want to provide personal cleaning supplies to the person who is sick, like tissues, toilet paper, paper towels, cleaners, and disinfectants. If you do have a shared bedroom, so having to share a space with another person, want to make sure that the room has a good airflow, maintain at least 6 feet between the beds if possible, sleep head to toe, and put a curtain or physical divider to separate the ill person's bed. If you share a bathroom with the person who is sick, you should clean and disinfect it for each use. If not possible, the caregiver should wait as long as possible before cleaning and disinfecting. And when you do have to clean and disinfect, we want to make sure that we clean and disinfect the frequently touched surfaces in the bathroom after each use. If not possible, the person who does the cleaning want to make sure that they open the outside doors and windows before entering and use ventilating fans to increase the air circulation and increase the air movement in that area. And then also wait as long as possible before entering the room to clean and disinfect or to use the bathroom. Now, cleaning and disinfecting if someone's sick, we'll talk about food. So staying separated, the person who is sick should eat or be fed in their room if possible. Make sure that we wash dishes and utensils using disposable gloves and hot water. Handle any used dishes, cups, glasses, or silverware with gloves. Wash them with soap and hot water or in the dishwasher. Clean hands after you take off your gloves and handling used items. Remember, washing your hands for at least 20 seconds with soap and water. Now, handling trash and garbage. Make sure that there's a dedicated lined trash bin if possible, a dedicated trash bin for the person who's sick. Make sure you use disposable gloves when removing garbage bags, handling and disposing of trash. And as always, wash your hands afterwards. Now, the EPA, or the Environmental Protection Agency, has approved a few common disinfectants that we'll talk about. If you go onto this link, the EPA.gov, they have a website where you can search for certain approved products. So all products on this list meet EPA's criteria for use against SARS-CoV-2 or the coronavirus that we know as COVID-19. Instructions for how to use the list to search for products are available on the link above. When using an EPA-registered disinfectant, follow the label guidelines for safe and effective use. Make sure to follow the contact time, which is the amount of time the surface should be visibly wet. Each product differs by a few minutes depending on their product. These products are for use on surfaces, not on human, not on skin, and not ingestible. Some popular brands include brands that we might know, such as Lysol, Barbicide, and Clorox. What to do if you own pets? A very common question that people might ask. Well, researchers are still learning how the virus affects animals. Make sure that you treat your pets as you would any other family members to protect them from possible infection. Do not let pets interact with people or other animals outside the household. Keep cats indoors when possible to prevent them from interacting with other animals or people. Make sure you walk dogs on a leash or cats on a leash, maintaining 6 feet from other people and other animals. Make sure that you try and avoid dog parks or other public places where a large number of people and dogs gather. And
All right, so I'm gonna take over from here. So now we're gonna talk about cleaning your groceries at home. And so many times people will go to the store to get their groceries, but if possible, you could do curbside pickup instead of going to the store to get your groceries to limit your exposure. Even if you do a curbside pickup or a delivery grocery service, you'll still want to handle the groceries carefully when they're delivered. And if you go to the grocery store to get your groceries, you'll also still want to handle your groceries carefully when you bring them home. At the very least, everyone should wash their hands after unpacking and putting away your groceries. You can also wipe down or wash cans and boxes of food before storing them, or throw away any disposable packaging. Like, if, for example, if you buy boxes of cereal, you can throw away the cardboard boxes, and then you can store the plastic containers of cereal. And then after you put those plastic containers away, you would wash your hands. When you're done putting away your groceries, you want to disinfect any countertops or surfaces that came in contact with your groceries or grocery bags, and wash your hands again. And if you use disposable bags, like plastic bags that you usually have to pay 5 cents for at the grocery store in Suffolk County, you can just dispose those in the garbage. But if you use cloth reusable bags at the grocery store, you're going to want to wash them with soap and water in the laundry machine and dry them thoroughly before reusing them again. So there are some people who recommend cleaning food like a surgeon. So if you or someone you know are especially at a higher risk of severe illness from COVID-19, like those who already have health issues, if you're immunosuppressed, maybe if you have cardiovascular disease, you can use a technique recommended by Dr. Jeffrey Van Wingen, which is available to watch on YouTube. Dr. Van Wingen says, if possible, if you could leave your groceries in your garage or porch for at least 72 hours. So these would be the groceries that are non-perishable food items. So any of the canned items, anything that comes in bags, like chips, the cereal boxes, that sort of thing, or even vegetables that you don't have to refrigerate. Maybe you could leave those outside, but any perishable items you would still want to bring into your house and disinfect how he recommends. So if this is not possible, he suggests using a sterile technique like what surgeons do before they go into the operation room. And his videos are available for free on YouTube. So I have a few of them linked here. And we're not going to watch them right now because they are very long, but these slides will be available for you to watch in your spare time. Basically, what he recommends is you would keep one portion of your counter that would be the clean area, and one portion of your counter which would be the disinfected area. You'd mark it with a line. I think he used masking tape. And then what you would do is you would wash your hands, and then as you unpack all the items or disinfect them, after you wipe them down, you would put everything in the clean area. And then when you're done, you would disinfect the side of your counter that had all the dirty items on it, and then afterwards you would wash your hand. So this technique isn't, especially recommended by the CDC or anything, but if you want to be especially careful about disinfecting your food or groceries or any packages that you come in contact with, if you have pre-existing health conditions, this might be a good source for you to watch. He also does that for mail, and he does it for delivery services if you order pizza, what to do with a pizza box, that sort of things. And there's also some other articles here, healthy eating tips, and a medically reviewed article by Everyday Health, which is a guide on how to handle groceries and takeout during COVID-19. So now I'm just going to walk us through some additional community resources that are available for everyone. And these are just in case any of you guys need these resources. So there's a Suffolk County information line dedicated directly to COVID-19 resources, which you can see here is 311. There's also Stony Brook Medicine Coronavirus Information General Hotline at 631-638-1320, as well as a pregnancy hotline at 631-444-8940. There's free COVID-19 testing by appointment only at 888-364-3065. And there's also additional information for social service agencies, if you need help with food or paying housing bills, or a COVID-19 screening tool in multiple languages, you can call 211. There's the National Domestic Violence Hotline, emergency child care services for essential workers, or if you need any help filing for Medicaid or New York State of Health insurance, there's the Medicaid hotline listed here at 800-541-2813. There's also DSS sanctions at 631-853-3644. So I also wanted to bring attention to any mental health resources. COVID-19 could be a time where people feel isolated and they're not as connected as they were. And so these are just some resources in case anyone needs it. There's the Family Service League's Diagnostic Assessment and Stabilization Hub at 631-952-3333. The New York State Hope Line, which is for addiction services, at 877-846-7369. The National Suicide Prevention Lifeline at 800-273-8255. Substance Abuse and Mental Health Services has a hotline at 1-800-662-4357, which is available 24/7 in English and Spanish. And there's also the Office of Mental Health free emotional support line for COVID-19 at 1-844-863-9314. And then we also have some more resources for food assistance. There's SNAP, which is linked here at this website, and WIC. SNAP and WIC are a supplemental nutrition assistance program, and WIC is the supplemental nutrition program for women, infants, and children. There's also Island Harvest, which has food pantries all over Long Island, and you can go to their website to find food pantries, as long as Long Island Cares and the Harry Chaplin Food Bank. And we also have a few resources for financial assistance and housing. So free or low cost Wi-Fi for qualifying individuals, assistance for paying energy bills and mortgages, and housing information for illegal convictions. So all of this information will be listed here, and you'll have the slide deck and the recording available. So that is pretty much the end of the webinar. We're hoping that you can complete a post-webinar survey, again, just to evaluate how effective the webinar is, and I'll link it in the chat box. And does anyone have any questions for us?
Yes, I'm from the John Jermaine Library. The alcohol content in the hand sanitizers and the disinfectants, you kept going back and forth between 60% and 70%. Is the 60% for the hand sanitizer, 70% for the disinfectants, or were both numbers close enough that it doesn't matter?
So 60% is what's recommended by the CDC for hand sanitizer, and then 70% is what's recommended by the CDC for disinfectant for surfaces. However, for hand sanitizer, depending on the type of alcohol in the hand sanitizer, there's different recommendations. So I believe it's if the hand sanitizer has ethyl alcohol, then it's 60%. But there's also some hand sanitizers that are made with isopropanol, and I believe for isopropanol, you would need 70% for it to be effective. But in general, for hand sanitizers, it's 60%, and for disinfectants for surfaces, it's 70%.
Thank you. And also when they were talking about cleaning with bleach, leaving it wet for a minute and then wiping it down. When cleaning with the alcohol, it pretty much evaporates, so it's pretty much just wiping it once, or does it need to go back and clean it again?
So with using plain, I think like rubbing alcohol, I think you would just need to get the surface like moderately wet, like moderately covered with the alcohol, and then just letting it dry and then wiping it dry to make sure. But if you use one of the EPA registered disinfectants like Lysol or Clorox, which we had on one of the slides here, on this website, you can go and they have all the registered disinfectants that can be used against SARS-CoV-2. Those disinfectants have specific instructions on the label for how to use them. So if the label says to let it sit for 1 minute until it dries, or to wipe it away, you would want to follow the specific directions for each disinfectant.
Thank you.
So thank you so much, Gabriella. There's a few more questions in the chat. I think because we're recording, we want to read them out loud and make sure that anyone who's not able to monitor the chat would have access to the questions and the answers. So I can start if you would like. there was a question from a participant who is finding difficulty in locating the type of alcohol that is recommended by the CDC. And so depending on what's available either online or in your community, I would just start with if there are stores in your community that don't have rubbing alcohol or the recommendations that are found in these resources, you might ask them and check back. It's definitely a challenge, right? That hand sanitizers and some of these products are being restocked, but maybe on a particular day are not available. And it's very frustrating when you want to have access to some of these cleaning supplies, but they are not available. While we were doing this, Gabriella was doing a quick online search to see what she could find. So Gabriella, do you have an update for some online options to order the right type of alcohol, rubbing alcohol and other cleaning supplies at this time?
Yeah, so I found it hard to find cleaning supplies, but for hand sanitizers, usually like the typical brand name hand sanitizers like Purell sell out really quickly, but there have been some kind of smaller brands that have been manufacturing FDA-approved hand sanitizers, and usually you'll be able to find those by searching like available hand sanitizers, and New York Magazine or maybe like magazines will compile them because they're usually smaller brands. So I found on New York Magazine on June 4th that there were some in-stock hand sanitizers from unlikely sources, and usually these hand sanitizers are manufactured by small beauty brands. So one of them, a few of them are Megababe. Megababe usually produces like deodorants for women, but now they're producing hand sanitizers that's FDA approved. Vegamore, which usually produces lash, brow, and hair growth serums, are now making hand sanitizer, as well as Say, which is like a clean beauty brand. Orally has come out with hand sanitizer, so Orally sells nail polish. And there's a bunch more on this list. Most of these brands, not everyone might know of. So it really just takes a lot of, Google searching. Chi, which also makes hair tools like hair flat irons, is selling hand sanitizers, and all of these are FDA approved. So it might just take a little bit more deep diving to find manufacturers who might not be selling on like Target or something like that, but might be selling on their own websites. But I can link this website in the chat and send it to everyone. I haven't been able to find other like rubbing alcohol, but you could also check like beauty supply stores sometimes sell rubbing alcohol, or hardware stores also sell cleaning and disinfecting products. So that might be a good place to look. So someone just asked to send the post link questionnaire. So I'm going to send that right now to everyone, and then we can discuss the other questions.
Gabriella just reposted the post questionnaire. Someone had asked for that. Yes, the slides will be available. I think we will add a slide with some suggested resources for ordering online hand sanitizers. We're going to add that slide based on the discussion questions today to provide you with a little some additional resources based on what you've asked for. Gabriella, can you speak to how the slides would be made available?
So I will be sending the slides to the Brentwood Public Library, and I'm not exactly sure how they're going to be posting them. Usually they get posted to the YouTube site, to their YouTube, but I will ask our contact at the Brentwood Public Library, all of you that registered for the webinar, I'll ask her to send the copy of the video recording and the slide deck to you, and then also let you guys know where the slides will be posted.
Okay, there's another question, two questions. One of them has to do with wiping down in the home, wiping down groceries. If you choose to do so, what would you use to wipe down groceries? And then the next question has to do with returning to the workplace Should we be wiping down desks and computers and phones that are shared with coworkers? So let's first answer the question about groceries. Gabrielle, would you like to answer that question, or Dr. LaSala, or Mr. Masala, would you like to answer that question?
I can answer it. So as per the slides, it's not necessarily recommended by the CDC to wipe down all of your groceries, but if you want to take the extra precaution, Dr. Jeffrey Van Wingen does offer you to do that. You wouldn't wipe down any of your food items with disinfectant, because then you would ingest the disinfectant later and that wouldn't be safe. But for anything that comes in like a box or a can, you could, or chips come in plastic bags, you can wipe down the outside of the plastic bags. For food items like fresh produce, it's recommended to just clean fresh produce how you would normally clean them, rinsing them under water or letting them soak in water. But the videos here go into more detail about how you would exactly do that, and I can also send you the links for those. So that's generally how you would disinfect food items. Same with delivery packages. You could wipe down the outside of boxes with disinfectant, or same for mail, but instead of maybe wasting your disinfectant on wiping down boxes, you could leave the boxes in your garage or outside your front door for maybe up to 72 hours. And then usually the 72-hour mark is the time when they say that COVID-19 is no longer on the surface.
Okay, then the question about should those who are in a shared workplace be wiping down desks and computers and phones, for example? Dr. LaSala, do you want to speak to that?
Sure. Yes, so anytime that if we're all going back to work, we should be wiping it down with the disinfectant if different people are touching your phones or your keyboard or your computer or your desk area. And that should be done if anyone else is coming forward and touching any of your supplies or your workspace. So yes, that should be done. And we need to be very careful about that. There might be the use of plexiglass. We've been talking about that at Stony Brook, putting up plexiglass like they do in the grocery stores so that you don't have direct contact with people. But just make sure that you're wearing your face covering if you're in an area where there's other people, and have people, stay at least 6 feet away from you also. Did that answer your question?
So the CDC does provide guidance on return to workplace and shared workplace with regard to reducing the number of people in the space, wearing masks, and distancing. And so we did provide and create resources for some shared spaces outside of the home, and we could make those guidelines available as well. If that is of interest, either as a new program or sharing our prior program, which was on disinfecting food pantries and other shared workspaces. These principles would apply in lots of different work settings where you want to, again, mask, reduce direct contact, and shared spaces as much as it's feasible. I think there might have been a new question. I'm having a problem scrolling down. I apologize.
Yes, there is a question about microwaving takeout food. Someone has heard that this kills the virus. I don't necessarily know if you need to like microwave your food to, to an extreme, but Dr. Jeffrey Van Wingen does have a video on takeout food, and really all of the restaurants that are cooking the takeout food are taking, extra precautions to protect against COVID-19. And so what's really recommended is that with takeout food, you just want to be careful about the outside packaging, the people that are delivering it, maybe wiping down the outside container. But I wouldn't be worried about the food inside the container. I would just microwave it, to your preferred temperature. I'm not sure
If you're using a microwave.
yeah. So the person said they heard for 20 seconds. Let me see. Yeah, I haven't heard anything about microwaving takeout food to kill COVID-19. That's not recommended by the CDC or any other reputable site to my knowledge. So I would just recommend disinfecting the outside packaging. If you want to take that extra precaution, making sure you wash your hands before and after you eat food is extremely important.
Great. Any final thoughts? It is 1 hour. We want to be mindful and respectful of everyone's time and try to stay within the time frame that we had proposed. But any final questions or recommendations moving forward? We really welcome what additional programs you might want to hear or any questions or comments that you might have to inform us of what we can do to support our communities on Long Island. So you're welcome to unmute yourself or send something in the chat if that's comfortable for you. We really appreciate any ideas.
And I've also sent the post-webinar survey in the chat again. If everyone could please complete the survey, it's really just gonna tell us how effective the webinar is. And there's also gonna be some general questions towards the end of the survey asking if you enjoyed it, if you thought there was anything that we missed, and if you have any future webinar topics that you would be interested in, we'd be more than happy to get those resources for you. And
So
then,
final question. The library books, should the books be kept for 72 hours before recirculating? So I think that question has to do with, how long might the virus live on a surface and what's the safe recommendation? So I will say that no one is an expert in this particular virus at this time, and the guidance and the recommendations do seem to change as we continue to learn more and more about this particular virus and how it behaves. So we will always reference what is the current guidelines and recommendations, and we don't pretend to give our own advice and guidance. We're relying on that of the CDC in particular. So at this moment, the number of hours that the virus lives on a surface, I've heard a range of answers from 3 hours to 6 hours. Anybody else on the call read something different? I welcome your feedback.
That's what I've heard also. Yeah, I think 72 hours is a long time, but up to 6 or 8 hours is what I've read also.
Mm-hmm.
According, just a quick search from the American Library Association, the Northeast Document Conservation Center is recommending 24 to 72 hour quarantine of returned books as the safest and most effective way to disinfect them, based off of like preliminary research. So
thank you for sharing that.
Yeah, so the CDC doesn't have, I don't believe the CDC doesn't have any recommendations for that currently, but I would just, research into that to see what the American Library Association and others are recommending.
Great, that's very helpful. We can add that, it's in the recording now, and that's something that we're going to look into as we continue to learn about the virus and recommendations for different settings. Thank you so much. So I think that we should I would like to thank all of our speakers and all of our participants. I'd like to thank the Brentwood Public Library leadership for partnering with the Healthy Libraries program at Stony Brook Medicine. I'd like to thank the outreach and particularly Mrs. Valerie Lewis, the Director of Outreach for the Suffolk County Cooperative Library System, and also the American Heart Association, which is a partner in this work. And we thank you today for including us in your day and giving us this opportunity to connect with each of you during this very, very difficult time for all of us. Thank you so much.
Thank you. And if you have any additional questions for us or anything you want to ask us, any health information related questions or any future webinar ideas or topics, please feel free to email us at healthy_libraries_program at stonybrookmedicine.edu. And if you're a public librarian interested in getting a continuing education unit credit for participating in this webinar, also please email us to request the certificate. Thank you.
Thank you.
Thank you.
Great job.
All right. Thank you. Take care, everyone.
See you tomorrow morning.
Thank you. Bye-bye.